Girls, so tell me what brought you into Young Medical Spa. What's your concerns and why are you here, and what can Young Medical Spa do for you?
Well, we decided to come in to Young Medical Spa because we knew of his reputation around the Lehigh Valley. We see all of his ads in Style magazine, as well as knew him when we were younger, so we thought what a great opportunity when we looked on your website to fill out a form and see what it was all about.
We didn't even really realize what was all out there as far as the new technology and everything that they do here, and when he explained it all to us, it was almost like a dream come true. Like, it wasn't that risky, the side effects weren't crazy, it just seemed very, very accurate, and everything that his reputation seemed to be a legit reality.
Not only was his reputation good, but the moment we walked in here, the whole staff was welcoming, the place was warm, comfortable. You didn't feel uncomfortable like you were going to do something you were so unsure about. When we sat upstairs and had a consultation, we were definitely eased with all of our worries. Absolutely. And the reality of getting it done became closer and closer for us.
And what are you here to have done?
We are getting our inner and outer thighs.
And why are you getting your inner and outer thighs done?
Problem areas.
Absolutely. It's always been a problem. It's just one of those things that you work out, you run, you do this, you diet and everything, and that one area just never goes away. So hereditary played a factor, and we just decided this is
sick of like figuring out the jeans but making sure the shirt's long enough and pulling it over a certain area and having to wear heels all the time.
Because we're short. We're like 5 foot, so
we're like these little people with these big legs.
You want to share your story with the Lehigh Valley?
Basically we want to let people know that it's real people with real problems. They may not be this huge to do, but there's little things that I want women to know that you can get accomplished, you can fix. Little things that bother you, you don't have to have any longer. And with a reputation like Dr. Young's and the ease of his whole staff, it's very much a reality.
And it's right here in the Lehigh Valley, and letting like younger people know as well that don't be afraid to fix things that you don't like, or be afraid to, you know, come in and just see what it's all about, because once you're here you'll realize the process is so much quicker and easier than you've ever had.
Alright, so our first step is that we're going to do some marking and then take our official pictures. Okay? Alright. Can you just stand there for me? Good. Next step is that we're going to clean you. Then we're going to put in the 2 mess and anesthesia. So that's what we're going to do. We're going to work on different positions. We're going to get them all numbed up, okay? This is the pinchy part when we do that, okay? So how does it feel?
It feels actually not as bad as you would think. There's a little bit of pinching, a little bit of pulling. So really your leg just starting to feel hard. But I'm doing alright.
We're doing step 1 here, which is the 2 mess and anesthesia. The patient's been cleaned and prepped. This is the pinchy part, first step to get her all numb.
How long does the pinchy part take?
Just a few minutes every spot. You can already feel it going numb. You can already feel it's a lot less than we started. The next step that we're going to do is going to be the laser and the suction, both of which there should be no discomfort, maybe an occasional pinch, but there should be really no pain there. They should be nice and relaxed when we do it. Right now we're just setting up the SlimLipo laser. Patient's been cleaned and draped.
Settings?
Patient, how are you feeling?
I'm feeling good.
Are you having any discomfort?
No, I'm fine.
Are you wide awake?
Wide awake.
Wide awake. Alright, so we're about to do our laser. The patient has had a 2 mess in. Are you feeling okay? Having any pain? For the laser part, there should be no discomfort at all. When we laser for a small area or for a prolonged time or for heating, we'll monitor the skin temperature to get optimal tightening without going into the danger zone. So we're doing some gentle aspiration, gentle suction after the laser was done. Patient's having no discomfort. Inner thighs are an area prone to irregularities. So great care and experience is necessary to sculpt the inner thighs to a very natural look.
It's much better than I had anticipated. it. I'm ready for it to be done.
All right. Okay, now that your procedure's done, how do you think it went?
It went great. Honestly, I'm excited for the recovery process to start.
And what was the hardest part of the procedure?
Just the pinching. You can hardly feel it. Sometimes your legs just start to feel a little tired throughout the procedure, but it's not bad.
And did you feel the laser at all?
No, don't feel the laser at all. The suction a little bit. The best part was that you weren't put under anesthesia, because your thought is that you're going to be very groggy when you come out of it, but you're completely awake and aware of what's going on, and it makes the process so much better.
So you're happy you weren't knocked out completely cold?
Thank goodness I wasn't. I'd be like a zombie right now.
Were you able to communicate with the physician during your procedure?
Which was the best part. I could say what was bothering me, what wasn't bothering me, and we were able to work together.
And how do you feel now?
I feel good. I feel much better than I thought.
So we're doing the outer thigh, we're doing the inner thigh. We're going to just do a hair underneath the buttocks because it's a trickier area. We don't want to cause any irregularities. Patient took a look at the areas with her mirror. Take a look. Okay, good. Do those look like the right spots?
Yes.
They look like the right spots we talked about? Good.
Yep.
So we always want to confirm just to make sure everybody agrees what we're doing. So the procedure that we're performing today on you is known to the public as SmartLipo.
Okay.
More technically, it is awake, tumescent, laser, liposuction.
Okay.
And in that is the steps. You're awake. The tumescent part is the anesthesia, which we're doing now.
Okay.
Laser is step 2, and then the suction is step 3. We're only doing step 1 now.
Okay.
So the tumescent anesthesia, that's just the IV fluid filled with lidocaine and epinephrine.
Okay.
That numbs it, and that's the trick. That's what allows us to do it while you're wide awake.
Cool. Okay.
Okay, so tumescent, that's tumescent.
Okay.
Tumescent means to engorge or make big,
Okay.
I guess, if you look it up in the dictionary. So we're doing our tumescent anesthesia. We're gently putting the liquid underneath the skin. There's some mild to moderate pinching when we do it. This is step 1. And this numbs the patient up. We're doing all the areas at the beginning. So when we come back to the first area, it's been anesthetized for a good half an hour, at least. Besides numbing medication, there's also medication in here to stop bleeding. Alright, so step 1 is complete, which is the tumescent anesthesia. We're going to start step 2. The energy from the laser goes into the fat cell and makes it pop or explode. A very gentle process. Makes the extraction of the fat much easier when we let it take out. It also helps with smoothing and skin tightening. We're using the Palomar SlimLipo machine, which has the wavelength of 924 and the wavelength of 975.
Okay, patient, how are you feeling?
Good. Comfortable. I don't feel anything. Just feel like we're all hanging out.
Maybe some suctioning. Maybe a little pinch, let me know, but it should be mostly pretty comfortable, okay?
Okay.
Okay, your procedure's all done.
Yes.
All right.
Yes.
Now tell me how it felt from what happened to what you were perceiving would happen.
My expectations were far exceeded. This was a breeze. I mean, I feel like I was at a massage therapist. Just chilling. Honestly, it was like nothing. It was so easy.
And
Painless.
what about being
Painless.
coherent enough to talk to Dr. Young through the procedure?
I was completely, we talked the whole time about everything and anything. No problems at all. He asked, every couple minutes how I was, if I had anything to let him know, and I really didn't have anything to let him know. Pain-wise, it was totally smooth sailing, honestly.
Well, this is the reason why we're making this video. Is a lot of people think that you're knocked out cold or you're groggy and you can't communicate how you feel, or
Oh, no.
it's
No.
excruciatingly painful.
Not at all. Honestly, a pinch was all you felt in the beginning, and then the rest of the time it was honestly nothing. And we talked the whole time. Absolutely.
Okay, well, we're going to see you in a month for your follow-up.
Yay.